welcome to the Florida Nurse Practitioner, ranked as one of the best medical podcasts in Florida. This is the official podcast of the Florida Association of Nurse Practitioners, the premier APRN advocacy organization in Florida for all nurse practitioners. If you're not a member, you should be. Join today. Just go to flanp.org and click on the red box, Become a Member Today. Members get all kinds of perks, including discounted CEUs, including autonomous practice recertification CEUs, insurance discounts, free monthly CEUs, and plenty more. So join today and make your voice heard. Help us help you. We are here to support all APRNs in Florida to practice to our fullest ability of our education and elevate the APRN profession in Florida. I'm Paul Bond, APRN, your host for this show, and I want to thank you for listening to the show and helping make it one of the 10 best ranked medical podcasts in Florida. On today's show, a new call to action, new dementia and Parkinson's research, and more. But first, some housekeeping. Hello and welcome to the official podcast of the Florida Association of Nurse Practitioners. FLANP is the premier nurse practitioner organization in Florida. We represent all advanced practice nurses. Our mission is to educate the public on advanced practice of nursing, remove obstructions to the advanced practice of nursing, and work to remove barriers to access to care for all Floridians. From support to nurse practitioner business owners to educating the general public on documented research-backed evidence that nurse practitioners provide quality care equal to and sometimes better than physicians, to lobbying efforts to expand nurse practitioner ability to provide care to the fullest extent of our training, education, and licensure, FLANP is at the forefront of advocacy. And the proof is in the details. FLANP is the largest nurse practitioner advocacy organization in the state. We now have 2 professional education conferences, one for business owners and one more clinically oriented. We are the only NP group in Florida producing a podcast, and this show, is one of the 10 best medical podcasts in the state. And we still have much more coming down the road. Our inaugural boot camp for business will be held October 31st to November 1st in Orlando, and will be a 2-day intensive on starting, managing, and running a healthcare practice for nurse practitioners. Attendees will have the opportunity to leave with their entire business plan, including potential funding and a business plan in hand, ready to hit the ground running with their own practice. And our next annual clinical conference will be a joint conference between NNPEN, which is a national organization that supports and educates nurse practitioner entrepreneurs, and ourselves. It will be in April 2026 in the Tampa area. As a statewide organization, we believe our strength is in our membership. To support them and engage more closely with them and you, our members, we routinely will be moving our conference to locations all over the state. Instead of you having to travel to us, we're coming to you. Are you wanting to help this organization grow even stronger and be part of something big? There are plenty of opportunities to volunteer. We're always happy to have you join our team on the legislative, business, or education or conference committees. If you have an idea for education presentation, we can help you put it together and offer it to other nurse practitioners. This can help build your CV. Are you thinking of starting your own practice but don't know where to begin? Come to the boot camp and or join the business practice group. Or maybe you want to be a part of changing the rules and helping expand nurse practitioner ability to provide care. Then, if that's the case, join the legislative committee and help us gain the ability to practice to the fullest extent of our education instead of being hamstrung by outdated and antiquated laws that needlessly tie us to physicians. Join us today and start helping us make a real difference for our patients. Now, first up, as I mentioned in the opening, we at FLANP have a new call to action for all our listeners and followers. This has to do with insurance companies in the state, health insurance companies. Health insurance companies are quietly shutting down NP-operated clinics across the state. They're being dropped by Medicare and Medicare Advantage plans for no reason and with no warning. This is going to increase the problems for access to care for all Floridians in the state, even if you do not have either one of these plans, because currently wait times to see a medical provider in the state are about 3 weeks if you're an established patient, and currently almost 2 months if you're not an established patient. So decreasing the amount of clinics that you are able to go to is going to increase that wait time, even if you are not part of these groups that are dropping NP clinics from reimbursement. What can you do? Well, if you're a nurse practitioner, you're more than welcome to join FLANP. If you want to be an advocate, you can also join as an advocate to FLANP. But you can also call, stop in, or write your local state legislators and voice your frustration with this. As I said, this situation is going to be limiting access to timely care for all patients in Florida, whether or not you have a Medicare or Medicare Advantage plan. So contact your state legislators today, and if you have any questions about this, go to flnp.org, or you can call or write our office, and we'll be happy to give you more information on this and what you can do to help. And now for some news you can use. First up, 25 August 2025, out of Nature Medicine, interplay of genetic predisposition, plasma metabolome, and Mediterranean diet in dementia risk and cognitive function. Alzheimer's disease and Alzheimer's disease-related dementias have a substantial genetic basis, with APOE4 homozygotes increasingly recognized as a distinct genetic subtype. To identify genotype-specific metabolic pathways and modifiable risk factors, researchers integrated genetic, plasma metabolomic, and dietary data from 4,215 women and 1,490 men in prospective cohorts. People who carried the Alzheimer's disease APOE4 risk gene had a lower risk of developing dementia if they followed a Mediterranean diet. To quote one of the researchers, these findings suggest that dietary strategies, specifically the Mediterranean diet, could help reduce the risk of cognitive decline and stave off dementia by broadly influencing key metabolic pathways. This according to Dr. Liu, the study co-author. He also goes on to say, this recommendation applies broadly, but it may be even more important for individuals at a higher genetic risk, such as those carrying 2 copies of the APOE4 genetic variant. So here again, as I've mentioned many times before, allopathic medicine is finally catching on to what functional and integrative providers have known for quite some time now. Diet influences and modulates disease, and as APRNs, we are perfectly positioned to use this information to our advantage. So educate your patients about the benefits of the Mediterranean diet, and this is just one more in a long-standing line of reasons to follow it. And this next article is an interesting follow-up to that. This is from 27 August 2025 from Becker's Administrative Review. HHS, which is the Department of Health and Human Services at the federal level, and the Education Department push medical schools to revamp nutrition education. HHS and the Department of Education have called for immediate reforms on how nutrition education and training are implemented in U.S. medical schools as part of a sweeping initiative to tackle chronic disease and promote prevention-focused care. This call outlines 6 core reform areas for nutrition education requirements to be embedded, including pre-med standards, medical school curricular integration, medical licensing examination, residency requirements, board certification, and continuing education. Many physicians graduate having completed less than 2 hours of nutrition instruction, with only 14% of residency programs requiring a nutrition curriculum at all. And here again, we as APRNs are light years ahead of this in this respect. Use this to your advantage. Allopathic medicine is finally catching up to the fact that diet and nutrition greatly influence overall health, like I said, and that prevention is much better and less costly than treatment for disease to begin with. We already know this from our nursing education. Leverage that to your and your patients' benefits. We should be standing out in this area. This is something that I have advocated for since before starting this podcast, but for sure on this podcast. Diet and nutrition are a basis for all health and lead to or exacerbate pretty much every disease. And as nurses, we have a very solid background in diet, nutrition, and lifestyle and assessment of such. So we should be putting that to use as nurse practitioners and setting ourselves apart, especially with all these big changes at the federal level. Again, this is from HHS and the Department of Education. They are now seeing what we already know. So don't be quiet about this. Start speaking to your patients about it early and often in every visit if you possibly can. And next up, 29 August 2025, from MedPage Today, Parkinson's largely is a preventable disease. This article is an interview with Dr. Ray Dorsey about his new book, The Parkinson's Plan. According to he and the co-author, Dr. Michael Oken, quote, "It is not just found in older men. It affects everyone. It is predominantly due to genetics. It is not predominantly due to genetics. Rather, chemicals in our food, water, and air have created this largely man-made disease," end quote. He goes on to discuss the original definition of PD included being only in men and only those over 50, and blamed on age and generally genetics. But they discuss in the book and in this article 2 recent cases in women, both in their 40s. Researchers found a link to man-made chemicals that very few neurologists are taught about, including trichloroethylene, or TCE, and perchloroethylene, PCE, both commonly used as cleaning degreasers and dry cleaning agents, and they may be the most important causes of PD. TCE is used to degrease metal and decaffeinate coffee. Let me say that again, to decaffeinate coffee. And the book lays out that what can be done past just banning these chemicals, which apparently the FDA has recently done. Other ideas include washing your produce, preferably getting organic produce or growing your own produce, avoiding dry cleaners that use PCE, using an air purifier if you live in a heavily polluted area, and adding a water purifier to your home. Here again, APRNs are already perfectly positioned, as I've said before, to take advantage of this information also. We already assess our patients more holistically and can easily add these suggestions into discussions with our patients, so you can help limit PD to begin with and slow down the disease with these suggestions. And there are many others in the book, so you may want to pick up a copy for yourself to read it. Again, it's called The Parkinson's Plan. And last up, 29 August 2025, again from MedPage Today, higher potassium goal wards off ventricular arrhythmias. This article discusses a conclusion from the POTCAST, POTCAST, trial concerning a reduction in the risk of ventricular arrhythmias. High-risk patients, comprising those with implantable cardioverter defibrillators, or ICDs, and either low to normal potassium or outright hypokalemia, had improved clinical outcomes over 3 years in the study if they had been randomized to a new potassium target of 4.5 to 5, as opposed to the usual care. Among patients in the high normal potassium group, 22.7% experienced a primary composite endpoint event compared with 29.2% of those in the usual care group. There were no significant differences between the two groups for hospitalization for heart failure or death from any cause. Hospitalization for hyperkalemia or hypokalemia was also similar between the two groups. So this may be something for you to do more research on if this is a patient population that you see. And obviously here in Florida with aging population, we are seeing more and more people live longer and are having ICDs. It's now becoming a much more routine kind of thing. So this may be popping up in your practice, so it may be something for you to look into. And that's all I have for you today. As always, I sincerely appreciate those of you who listen to and follow the show. It's because of you the show is ranked as one of the 10 best medical podcasts in Florida. Thank you for listening to the Florida Nurse Practitioner podcast, a production of the Florida Association of Nurse Practitioners, the largest APRN advocacy group in Florida, and the group that literally wrote the book on APRN practice in the state. Our groundbreaking book, the Florida Nurse Practitioner Handbook, continues to be used by more APRNs and is being used in multiple APRN education programs in Florida. Get your copy today at Amazon in either physical paperback or digital download. To stay up to date with everything FLNP, check out our website on a regular basis and or follow us on all social media platforms. Plenty of new things are in the works, including our next annual conference, which we're hard at work planning, and new educational offerings, and plenty more. If you're not a member, you're really missing out on a lot of great benefits, so join us today and help make us an even greater impact organization. As always, this is Paul Bond, APRN, for the Florida Nurse Practitioner Podcast, a presentation of the Florida Association of Nurse Practitioners, the premier organization for all APRNs in Florida, and the largest APRN advocacy organization in the state. Thanks for joining me today, and have a great day.